Good afternoon, everybody, and welcome to our webinar today. I'm sorry that you can hear me but can't see me. We're having a bit of a technical glitch and we can't turn our cameras on, but that's fine. We'll go ahead anyway. My name is Jenny Pearson. I'm an Education Officer for the Primary Health Network. Before we go any further, I'd like to acknowledge the traditional custodians of the land that we're meeting on today and pay respect to elders past, present and emerging. I'm coming to you from Enawan land in Armidale. Our webinar today is changes to mental health referrals. We have three presenters. Natalie Plowman, who is the Senior Project Officer, Mental Health and Suicide Prevention for the Primary Health Network. Hannah Beamish, who is the Commissioning Coordinator, Mental Health and Suicide Prevention for the Primary Health Network. And we also have Vikram Palat, and I will let Hannah tell you Vikram's details, and I will hand over to Hannah now. Just one more thing, this session is being recorded and will be available in our education library. If you do have any questions, please type them into the question box. We will endeavour to answer them as the webinar's going, and we will have 5 or 10 minutes at the end of the session to do Q&A. Thanks, Hannah.
Thanks, Jenny. Welcome to the Changes to Mental Health Referrals webinar. So my name is Hannah Beamish and I'm joined by Natalie Plowman and Vikram, who will be taking you through the changes and what you need to know about how to help your patients access our Mental Health Commission services. So just as Jenny said, this webinar is being recorded, so please ensure that your microphone is muted and your camera's off. We will begin our webinar with an acknowledgement before outlining the changes and providing a description of the new model. So Vikram from Consult Med is also joining us to provide an overview of how to do an e-referral so consumers can access PHN Commission services. Like Jenny said, if you do have any questions, please put them in the chat question box. If we can answer them during the webinar, we will at the end, just to ensure smooth running. Otherwise, we will take them on notice and circulate a Q&A sheet for everyone to see following the webinar. So Jenny has already done an acknowledgement of country, but I'd also like to acknowledge those with lived or living experience of mental ill health and their carers, families and supporters. So thank you for joining us today. The purpose of this webinar is to provide you with information on upcoming changes to mental health referrals. We'll cover what is changing, what is new to the system, and what you need to know. So we'll start by exploring what the current state is, as well as what's up ahead. So our Central Intake Assessment and Referral Service, also known as PRIMA, was made up of three service providers that received referrals from within each of their regions. They assessed them, then they distributed them to distributed the referrals to local PHN Commission services. We'd like to thank Hunter Primary Care, Coast and Country Primary Care, and Healthwise for their service to the community by playing this important role by distributing those referrals. So you might ask yourself, why are we changing the model? The Head to Health telephone service, which is a centralised statewide initial assessment and referral service, has been operational since 2021, and you may already be familiar with that. In December 2022, NOWS Consultancy reviewed the Head to Health service and delivered a report on behalf of the New South Wales PHNs to outline recommendations to improve service delivery for consumers. So it was recommended that one PHN deliver the initial assessment via a centralised telephone hub on behalf of all New South Wales PHNs and remain the single point of contact for consumers moving through the service. It was also recommended that each New South Wales PHN deliver region-specific referral spokes, enhancing consumer experience with warm transfer and referrals to the most appropriate services within the individual PHN regions. And this includes linking in with the community and tertiary mental health services where appropriate. So following review of that report and direction from the Commonwealth Government, the statewide Head to Health hub and spoke model has been created, and that's what we're moving to. So we have subsequently been decommissioning PRIMA, and we are in the process of moving to the new model by establishing a local referral spoke. So this is just a little graphic of what the referral spoke will do. The Head to Health hub and spoke model went live for the state in July 2024. The model incorporates a statewide Head to Health telephone intake and assessment hub service and a locally commissioned referral spoke. So we have taken a staggered approach to implementation, and we will be launching our local Head to Health spoke on the 1st of October. The key change is that there will be one entry into commission services, and that's via the Head to Health hub. So instead of going into 3 different services, it'll be going into just the one, and that's the Head to Health hub. The Head to Health hub can be accessed by members of the public via self-referral, and that's through calling the 1-800 Head to Health phone number, or health professionals can send referrals on their behalf, and we'll take you through how to do that in a little bit. So when a consumer rings or a referral is received, the hub clinician will undertake an intake and assessment with that consumer by going through the initial assessment and referral decision support tool, or the IARDST. You might be familiar with that. And this will establish their IAR level and subsequently what services are most appropriate for them. For level 1 consumers, they are provided with information about local psychosocial support groups or might be given some resources on self-management. For consumers who are assessed at being between levels 2 or 4 and also assessed as being eligible for PHN commission services, their information is securely passed through to the referral spoke, who utilise their local knowledge to identify the most appropriate service or services for that consumer. The consumer is then informed of the services that are local to them and are appropriate. Consent is gained, and then the referral is passed through to the service providers. For consumers who are assessed at being level 5, and that's the most acute level, they are given a warm transfer or a warm referral directly into the local health district services. In the event where a consumer presents and there is a significant risk to their health, emergency services are contacted. I'll briefly talk through eligibility. So eligibility is remaining the same at the moment as what Prima was. So that's a focus on priority populations. So some of these priority populations include residents in RACFs, people who are less able to pay fees to access private mental health services, children under 12 years of age with mental health, emotional or behavioural disorders, women with perinatal depression, Aboriginal and Torres Strait Islander people, people from culturally and linguistically diverse backgrounds, and individuals who have self-harmed, attempted suicide, or who have suicidal ideation and can be appropriately managed in a primary healthcare setting, as well as people living in rural and remote areas. So I'll now hand it over to Natalie, who will take you through the patient journey and share some information on how to access the service before passing it on to Vikram. Thanks, Natalie.
Thanks, Hannah. So the next slide is what happens to my patients. Hannah, are you able to click on? Thank you. So the Head to Health Hub will receive the referral through from the primary health clinician. Just to let you know, all the referrals are going to be clinically assessed, and the Commonwealth's initial assessment and referral decision assist tool will be applied to inform the most appropriate referral pathway within our stepped care continuum. Within this model, the consumer is only going to speak to one clinician when interacting with the service, and that is a hub clinician. So once the referral has been received, the hub will contact the patient to undertake an assessment and complete the IAR-DST. Once that assessment has been completed, the patient information is shared securely with the local referral spoke, who then will identify the best available PHN commission service for that patient. The locally based spoke staff are going to work with the statewide Head to Health hub to refer consumers on to the most appropriate support in their local area. And to do that, the patient is going to be offered, where eligible, a PHN commission service. If the patient consents to that referral being made, that referral is then made to the service provider, who will initiate contact with the patient to book an appointment. moving on to what information that you need to know. So there are a number of different PHN commissioned mental health services. We commission a broad range between levels 1 and level 4 on the step care continuum. On the graphic on the slide, and hopefully you are able to see and read that, it does outline what the stepped care is from level 1 up to level 5. Level 1 is focused on self-management through to level 4, which is high intensity intervention. For those level 5 patients, that they access acute and specialist services which are provided by the LHDs and not provided by the PHN. The IAR DST tool clinically assesses individuals based on a range of factors, including symptom severity, risk of harm, patient history, and engagement and motivation. The tool is used along with clinical judgment to identify the level of care a patient needs. The PHN does provide training on the IAR DST. So if you'd like to know more, we've got some upcoming workshops with the training dates listed on the slide there. There's a few dates happening on October. GPs are remunerated for their attendance, and the sessions are CPD accredited with the RACGP and the ACCRM. If you'd like more information, please head to our PHN website and you'll be able to search for IAR DSD tool, and that provides further information and also how to register for that training. So what else do you need to know? So most importantly, this change is occurring next week. So from next Tuesday, the 1st of October, all referrals intended for the commissioned services must be submitted to the Head to Health Hub via one of the following methods. So either via the Consult Med web form, which we'll be taking you through shortly, via the Consult Med widget, which is available in Best Practice or Medical Director, or by calling Head to Health on 1-800-595-212. Now, something that's important to note that in accordance with the Privacy Act, any referrals that continue to be sent to Prima, which will no longer be in existence from the 1st of October, or to service providers directly will be returned to the referrer, along with information on how to refer to the Head to Health Hub, either via the web form or via the GP software. And just to clarify, the services which are accessible via referral to the Head to Health Hub are all PHN commissioned mental health services and also Medicare mental health centres. Patients can still walk into those centres if it's local to them. They don't have to arrange to go via the Head to Health Hub, but it may also be appropriate once they've been assessed that that is the most appropriate service for them. Updated information will be available on Health Pathways, either the Hunter New England Health Pathways website or the Central Coast Health Pathways website, along with details of how you do the referral via web form. So now I'd like to pass on to my colleague over at Consult Med. So I'd like to welcome Associate Professor Vikram Pallet to join us in the webinar. Vikram is going to walk us through Consult Med and walk you through how a referral is made. So thank you, Vikram, for joining us today, and I'll hand over to you.
Thanks very much, Natalie, thanks for the introduction. My name is Vikram. I'm a paediatrician based in Sydney and also the CEO of Consult Med. Unfortunately, I'm not able to share my screen. I think it's the same technical issue as with the camera, but I will.
I'm just going to quickly make you an organizer, Vikram. Sorry about that. And it should let you share your screen.
Excellent, it's now working, so I'll be able to take you through it. So just to give you a bit of an introduction about Consult Med, and then I'll take you through a few of the different options for you to refer to Head to Health. So we're really excited to be part of this service, not least because it really streamlines all of the different types of referrals that you do into the one place, obviously with the aim of streamlining care. So on this slide, you can see that what the Consult Med system offers is multiple entry points. So one is a secure web form, which I'll show you an example of. And then, as you heard from the PHN team, that you'll also receive the direct links, and it'll be available in Health Pathways and things. So that's a very easy way to just send the referral directly from a secure web form, and that's been live actually across New South Wales in a bunch of places, North Coast PHN and also in the Hunter area. You're able to send the referral directly from the Consult Med web app as well. So many of you listening in may already have the system under use, particularly with sending referrals to the Paediatric Network, to Sydney Children's Hospitals Network. So you'll also find Head to Health become available end of the week there as well for you to send referrals there. You can, as mentioned, send the referral directly to Medical Director and Best Practice at Genie as well through the Consult Med widget. Again, we're very happy to support the implementation of that, and we do that quite regularly. So if there are FAQs, there's a video, there's a bunch of things that I'll show. But if your practice does need any help, please feel free to just contact us, and we can do training, and we can also provide help to how to install it. And we will also be able, you'll also be able to send it via medical objects as well for those of you who are using medical objects. The good thing is it'll all come into the same inbox on the other side for the clinicians at Head to Health to then triage and contact the families. Some of the benefits around it, so it's secure communication. And so as we particularly move away from non-secure email and other systems, fax, etc., this is a secure way to receive referrals, but also to receive advice and guidance back about the patient that you're referring about. And that's a really important aspect of it. So the clinicians on the other side will be able to review the referral that you send and then provide secure advice and guidance back to you about the outcome of that referral. Again, avoiding multiple emails and faxes and all of those things that are currently happening. There's referral tracking as well. So you can actually enable tracking for the referral. So patients and your carers will also receive tracking that you've sent a referral on their behalf, that the referral's been received by Head to Health, and that they'll be contacted. So again, reduces a lot of that back and forth that happens, and patients are actually engaged in the system because they know what's happening. As you know, we have integrations with the GP systems, and this is a point that's I just wanted to spend a few minutes on. We're constantly further improving the system for better integration. So we'll actually, for those of you who are best practice users, probably by the start of end of November, we'll go live with their BP Halo integration as well. So for those who have best practice, you won't need to download a widget anymore. We'll be native to their system, and you'll be able to enable Consult Med at a server level and then send referrals that way. We're doing the same with Telstra and Medical Director for hopefully for early next year. So we have the integration via widget, but we'll be able to do better than that very soon as well. The same is happening with Gen 2 as well for those using Genie and Gen 2. Finally, there is the good thing about this secure system is that you are able to capture consent straight away from the patient carer, sharing of information, reporting, all of those things, which again can be difficult to do with in those paper-based systems. So I'll just share my screen and just show you a few of those different entry points that I'm referring to. Can you see my screen at the moment with North Coast Head to Health?
Yes, we can.
Excellent, good. So this is an example of the form. Obviously, it's not going to be the North Coast PHN one, but this is one that's been live for for almost a year now, actually. And so on Friday, we will update this everywhere to capture Hunter, New England and Central Coast referrals as well, but you can see that and provide that link, but you can see exactly the information that will be needed to send a referral and everything you expect with those mandatory fields, consent to share information, who the referral is coming from, if you are able to do the IAR DST assessment, you can do that as well. So it asks you, have you done that before, accepting the terms of use, and then doing that assessment. And then obviously as a GP, if you see what the assessments come back, but then want to provide a different assessment, you'll be able to do that as well, and attach documents and things. So you can attach a mental health care plan, you can attach other documents, and that will go straight into the Head to Health Hub. And so a very easy way to send a referral that way. The second way is through ConsultMed, through the actual app as well. So some of you may have seen, so you just go to consultmed.co and then you create an account, a free account, obviously, in order to send a referral. And for those of you who have it already, you will know that there are a lot of services already using the system, obviously the Pediatric Network, but a few other LHDs also joining as well. Plus, you'll now be able to use the same system to send Head to Health referrals. And again, and there's a few videos and things around this, but you just click on New Referral and then are able to then pick the directory of services. So you'll be able to have Head to Health captured here as a favorite, and then you could also look up PHNs and then find Head to Health and then send the referral that way. Obviously, using the in-app system, it's connected to your best practice and medical director, so then you won't have to import the information in if you don't have those practice management software though, we do cater for that as well. So I'll just show you an example. Say you're sending a referral here and you've already written the referral elsewhere. You can use our AI technology to read the referral and then complete the rest of the fields. So you're not having to again put in the patient fields and things. You can just put that in directly using that AI technology, which is free to use as well. The final thing I wanted to show you, and again, this will be available in the FAQs and things, is how you actually get the integration with best practice and medical director. Just checking that you can see my screen with the video.
Yes, we can.
Thank you.
Okay, perfect. Yep, I'll just go through this. So for those of you who haven't GP, non-GP specialist, you fill in your details, your practice manager can fill in these details for you and invite you to join. We already have over 1,000 GP practices using the system in New South Wales. You put your APRA number in, we do an automatic check on APRA. You can put your provider number in, and you set yourself up. And it's at this point that you download the little widget that connects your instance of ConsultMed with your best practice or medical director. And you just follow the prompts, and that will then connect your system. So you don't need to input the patient information here. So you just double click on the integrator, and that will then install the system for you. Once it's been installed, you just log into Best Practice Medical Director and you'll see the ConsultMed widget sitting there. So when you have a patient open and you want to send a referral, in this case it's a referral to Head to Health, you just click on the widget. This forms a secure connection with your Best Practice and Medical Director. And so then when you click on New Referral, you don't have to put all the patient details in again. There's this import patient data button. You've got the patient open in BP or MD, and you just click it, and it fills in all of the details for you. You just check that you're happy that it's gone through correctly. And then same thing with the clinical details as well. So we've actually integrated to MD and BP in that way as well. So you pick where you want to send the referral. In this case, you can see it's to Sydney Children's Hospital, but Head to Health will be available. And again, in the same way, you might put in what the reason for referral is, and then again you just click import clinical data and it will fill this out from your practice management software directly, saving you from having to input that information in, and then you just send the referral. So that's a very quick high level of all of the different entry points in. I'm sure you've got lots of questions, so happy to answer any questions.
Thank you, Vikram. I was just wanted to check. We've had a message through that someone couldn't see the video, just a green screen. Was that the case for most people? I know on my side that I could see the video and hear Vikram, but just wondering if the majority of people couldn't. If you could just let us know via the question thread if you haven't seen it. Oh, it looks like quite a few people have seen it.
It will be
That's great.
recorded, so we'll be sharing the recording as well.
Yes.
Thanks, everyone.
Yeah.
Thanks, Anne. Okay, so we've
Thanks
got a
very
few minutes for some questions and answers. So we might start at the top and see what we can get through, and whatever we don't get through, we'll circulate. So we've got one. Where does this line sit in regards to the existing statewide mental health line? Is this a relationship, and is this a replacement, and what's the relationship? So it's not a replacement. If someone goes through to the hub and they need to access the statewide mental health line, they'll be referred there. GPs will still be able to call the number and access that. Work is being done to streamline them and improve the relationship, but no, it's not a replacement. The mental health line is for tertiary referrals. Thanks for that question. Natalie, did you want to take the next one?
So then, and we did have quite a few questions, so thank you very much. We will try and get through as many as possible, just aware of time. We will add that if we can't get through the questions, or if there's some questions we can't answer, we will be creating a question and answer document, which we will share out with people who have attended the webinar, just to make sure everyone is clear of what the answers to their questions are. So the next question is, if a clinician is making a referral, how can they be reassured that it will not be downgraded to level 1 by the hub? So all referrals are going to be triaged using the IAR DST, and clients are going to be offered the services that are clinically appropriate. So the clinicians within the hub will be doing that assessment, and they will be making a decision on what's the most appropriate services for that patient coming through. Okay, so there's lots of questions coming through. Just bumping up our question line. I want to make sure we answer them in order.
Okay, so the next one I have is, what is the evidence that the IAR DST is effective and safe at determining the most appropriate level of service? So the Commonwealth has invested heavily into the development and evaluation of this tool. So the states are actually moving towards embedding this tool into their intake services, including the mental health access line. But I'm sure we can find some links and some information to answer that in a more detailed way. But that's a great thing to note. But there is evidence to support the IAR DST. Thanks for that question.
Thank you. And the next one is, how does this change address underlying lack of capacity to provide services? And there was a query that the GPs are expected to carry the bulk of the load with minimal support for in-person services. So by moving to this system, we're going to be ensuring that access is for the most appropriate services offered. So whether that be a PHN commission service or Medicare mental health centre or self-management. So that is trying to equal the load across the whole state and in our region. The next question, thank you. The next one I've got, Hannah, is about why do GPs need to learn about the IAR if the hub is going to be using it? Yes, the hub will be using the IAR, and it is optional for GPs to be trained in. It is not a mandatory thing, but it is something that you might be interested in learning about, and something that you might want to use with your patients. So you're welcome to complete an IAR and undertake that training if it's not something you already use, it's something you're interested in, but the hub will be undertaking it as well if that's not an area that you want to train additionally in.
Just conscious of time, Natalie, we might have to leave it there. And and continue to answer the questions in writing, and we'll be able to circulate them to everyone that attended, as well as the recording.
Yeah, I just saw a quick question just coming at the very end. It's this just to ask if this is for mental health referrals. Yes. So someone's just asking if it's for mental health referrals only. It is for mental health referrals. So thank you everyone for coming today. We'll just pop our last slide up. We'll make a note of all the questions and make sure that we answer those and send those out to everyone, including the ones that we have already answered. We'll make sure there's a written response to those. But if you do have further inquiries, you can send them to Leah Morgan, who's our Senior Manager for Mental Health and Wellbeing. Her email address is on that slide in front of you now. As we have mentioned, it has been recorded, this webinar. Apologies again that we couldn't see your lovely faces and you couldn't see ours. But hopefully this webinar has been useful for you, and you will be able to refer back to it from next week, and also the information is going to be available on Health Pathways from next week as well. So when you are doing referrals, you should be able to access the appropriate information to make that referral to the Head to Health Hub.
And
Hannah, would you like to?
I was just going to say a big thank you to Vikram and ConsultMed for joining us
Yes,
today and
Yes,
running us
thank
through
you.
that. And they have additional resources that everyone can access.
thank you so much, ladies, and Vikram, thank you. Don't forget that we will have a recording on the website. There will be an evaluation that will pop up as soon as I press the leave button. So if you could just take a minute to fill that in, we would really appreciate it. And we will get that Q&A document sent out to you over the next couple of days. Thanks, everybody, and we'll hear you next time. Bye.
Thank you. Thanks, Jenny.
Thank you. Bye.